In the developing nations of West Africa, poverty and limited access to healthcare are a lethal combination. The harsh consequences are suffering, despair, and even death. With only one doctor for every 20,000 people, people with severe medical conditions do not receive the care they desperately need. Untreated tumors grow to staggering sizes. Even benign tumors can become a death sentence. Dense cataracts rob their victims of sight. Birth defects, such as cleft lip, are easily treated in developed countries, but in West Africa, such defects remain untreated. The situation is further complicated by a superstitious culture. Abnormalities and deformities are believed to be the result of a curse. Mothers and fathers abandon their own babies. Villagers reject their neighbors. And those who suffer physical diseases are burdened with devastating, heartbreaking isolation. But hope is not lost. Mercy is on its way in the form of a big white hospital ship carrying a precious cargo. Dedicated volunteers from over 30 countries. Since 1978, Mercy Ships, an international charity, has been offering first world medical care to poverty-stricken nations. By using a ship as its hospital platform, Mercy Ships can bring state-of-the-art equipment, such as CAT scans and blood labs, to countries that rarely have this type of equipment available. The ship also brings volunteer medical professionals from around the world. Each member of the volunteer crew, from the captain to the cooks, the deckhands to the medical teams, work together to support the 6 operating theatres, as well as eye clinics and dental clinics. Currently, Mercy Ships is focusing its service in West Africa. The process of transforming the lives of the forgotten poor begins at medical screenings. Thousands of Africans wait for hours in the hot sun for the opportunity to be seen by a highly skilled physician. Once it is determined Mercy Ships can indeed help a patient, he or she is given a date to report to the ship for surgery. For many, this moment represents a dream come true.
I've heard it said that for hope to be credible in the future, it needs to be tangible in the present. For hope to be believable in the future, it needs to be tangible, it needs to be felt in the present. And I think what happens when people have surgeries on board the ship, hope becomes tangible. They're better. And they go back to their village, and the village sees that they're better. And something happened that really worked. And that gives people a reason to hope in the future, really hope, because they've seen it in the present.
While life-changing surgeries take place on the ship, both medical and non-medical teams provide land-based services. For example, eye clinics provide eye exams and treatment, as well as distributing eyeglasses. The Mercy Ships dental team sees hundreds of patients every day at an off-ship dental clinic, and dental hygienists visit primary schools to teach kids the importance of healthy teeth and to distribute toothbrushes. Yes, West Africa is home to the poorest of the poor. The level of desperation is unimaginable, and hope is a rare and precious commodity. But when a Mercy Ship sails into port, optimism and anticipation break through the despair. Following the 2,000-year-old model of Jesus, Mercy Ships is love in action, so that the lame can walk, the blind can see, and the sick can be healed.
As you have just seen, it takes a dedicated team to transform the lives of people of West Africa. Transformation is possible through the dedication of our volunteer crew and of you, their donors and supporters. Our operating model is for crew members to pay their own travel and room and board to serve on board our hospital ship. This allows general donations to Mercy Ships to be used for direct patient care, community development programs, and other associated costs. Become a crewmate today by joining a crew member support team with your gifts of prayer and finances. Help us continue to bring hope and healing to the world's forgotten poor. Thank you, and God bless you.